Hi everyone. My name is Jennifer Dominguez. I'm a community relations specialist for CalOptima Health. I'll be talking about Medi-Cal in Orange County. I also do want to point out and kind of just give you a little bit of my background. A lot of times, people when they think about healthcare, they think the hands-on. But even like one of my friends, she's a nurse. She's like, I forget there's also another part to healthcare, which is the administrative part. So that's kind of where we come in. I've been with the organization for a little bit over 5 years, but I've been in healthcare for 15 years. Very first job was at a nursing facility. So I was the bingo lady and I did social services as well. Then after that, I worked at an Alzheimer's nonprofit. And then after that, I came to CalOptima Health in 2018. Actually, I started with the PACE program, which is for seniors, as an enrollment coordinator, and then came on to community relations in 2021. So that kind of gives me a little bit over 5 years here at the organization. So let me share my screen. I think it'll probably, let me see. Screen. I have like three screens. So if you see me looking that way, you'll know why. Um, so also I do want to mention there has been changes since I last presented. If you have heard, actually Kaiser is its own Medi-Cal provider. So for many years, it was just CalOptima Health administering the Medi-Cal benefits in Orange County, but now Kaiser came on board in January 1st, 2024. So the presentation that I will be discussing will pertain to CalOptima Health members. If someone is a Kaiser member, then they would have to call Kaiser to learn more about their benefits. Who's CalOptima Health? We're one of Orange County's community health plan for low income individuals, which can be families, seniors, and people with disabilities. So again, Medi-Cal is for low income individuals. So there's no age tied to Medi-Cal. It's simply for low income individuals. We serve 1 in 4 adults and 1 in 3 children. So, also something to keep in mind, we simply administer the benefits. We don't determine eligibility for Medi-Cal. Our mission is to serve member health with excellence and dignity, respecting the value and needs of each person. A little bit more about our updates. If you ever noticed, we rebranded our name and our logo, which I think took place like maybe a little over a year ago. So we used to be called just CalOptima, but we rebranded our name to CalOptima Health and our logo. We also launched the California Advancing Innovating Medi-Cal, which is known as CalAIM, and that is a 5-year state initiative that launched January 1st, 2022. And there's a slide that talks a little bit more about the CalAIM benefits, so I will talk a little bit more about that. We also launched the CalFresh initiative. Same with Medi-Cal, we don't determine eligibility for Medi-Cal, but CalFresh is another resource that's available in the community. So we did create posters, flyers, to raise awareness. We also did events as well in the community, so people had an opportunity to sign up for CalFresh. Also, when in 2021, we actually did COVID-19 vaccination clinics. So we did about 18 to 19 vaccination clinics in the community so people could have access to the vaccination. A little bit about our history. We've been in the community since 1995. Of course, we always started with a smaller membership. So at that time, we had about 180,000 members. And currently, we have 934,605 members that have Medi-Cal here in Orange County. Also, our programs have expanded. So, apart from Medi-Cal, there's One Care, which is for those individuals that have Medicare and Medi-Cal, and then the PACE program, which is a program of all inclusive care for the elderly. Also, our languages have expanded. So, we have 7 threshold languages, which are English, Spanish, Vietnamese, Farsi, Korean, Arabic, and Chinese. So, also, the materials are available in those 7 languages. And just a little bit about our members. If you break it down by ages, 36% are ages 19 to 44, 23% are ages 6 to 18. For the languages, majority of our members consider themselves English speaking, which is 55%. 30% are Spanish speaking, 9% are Vietnamese, and then for the other languages, 2% or less. And ethnicity-wise, less than 44% are Latinos, 18% are whites, 13% are Vietnamese, and then 2% or less for the other ethnicities.
I just click straight on like.
But that's just to give you an idea of the members that we serve in Orange County. The main question is who is eligible for Medi-Cal? And again, Medi-Cal is for low-income individuals, which can be children, adults, seniors. Right now, for undocumented individuals, if you've been hearing about the Medi-Cal expansion that occurred the first of this year, which means that before it used to be under the age of 26 and 50 plus, but now all ages for undocumented can qualify for full scope Medi-Cal regardless of their immigration status. Of course, people still have to qualify, but their immigration status is not a barrier anymore. Pregnant women can qualify, foster care children, people with disabilities, and also some individuals with specific conditions. So if someone's in dialysis, someone has a diagnosis of cancer, that can also help them qualify for Medi-Cal. And how does someone become a member? So, as I mentioned earlier, we don't determine eligibility for Medi-Cal. We simply administer the benefits. So, if you know someone that's interested in applying for Medi-Cal, they will need to complete the Medi-Cal application. And then once the application gets to Social Services Agency, keep in mind that the state has up to 45 days to determine eligibility. So a lot of times individuals might say, I applied 3 weeks ago, I haven't heard back. So just a time frame to keep in mind. And if someone does qualify for Medi-Cal in Orange County, now they will have the option of choosing either Kaiser or CalOptima Health. And I say Orange County because individuals can have Medi-Cal in California, but depending in the county they reside in determines who administers those benefits. So we have like our LA County, which is in our neighboring county. You have Kaiser, Care, and HealthNet there. And it's the same thing in San Diego County. You'll have other organizations that administer the benefits. But here in Orange County, you'll have either Kaiser or CalOptima Health. And if someone is assigned to us, it can take up for 60 days for the state to process because all the information that we receive from the state. But once we do get notified that we do have a member, we send them information on how they can select both a health network and provider within 30 days. That way they can start accessing their benefits. And also a reminder, you do have to renew your Medi-Cal application yearly. If you remember during COVID, people didn't have to update their Medi-Cal application in order to keep their Medi-Cal because of, of emergencies and stuff. But that process actually restarted last year in April, which means now that people will have to renew their Medi-Cal in order to keep their coverage. And where to apply. So apart from Social Services Agency, there are other community partners that can assist with questions regarding eligibility, how to enroll. So some of these other partners are the Coalition of Orange County Community Health Centers, Community Health Initiative of Orange County, also known as CHIOC. You might have heard them out in the community, and Cover California. So even individuals can go through these other organizations to apply for Medi-Cal. And documents to bring when applying for Medi-Cal. And keep in mind, you can apply for Medi-Cal in person, over the phone, or online. So some of these documents may be necessary, but every case is different. So someone might need a proof of income, a birth certificate, a proof of address that they do reside in Orange County, a personal ID, social security card, proof of citizenship, and in other cases, the IT number. But again, as I always say, every case is very different. So not necessarily will they need all these documents when applying. And once someone does get assigned to us, we send them a welcome packet on how they can select their health network and provider. What you see on the slide is the member handbook. If you're familiar with phone books, they're like about this thick. So we don't send 900,000 of those, but basically it's a provider directory. So, but if a member wants to request a copy, they can also request it. And we have different options in choosing the doctor and health network. So again, they can request the provider directory. They can search online at our webpage. They can also call us for assistance. We do have our customer service number and also visit us in person. We have our main office right in Orange, right across the block. And we also do have a satellite office in Westminster. So either site, they're also able to go and we can assist someone in finding a health provider and health network as well. And this is just an example of what it looks like when we send that in the mail. I always tell individuals, it may look a little confusing, but if it's just easier for them to give us a call, they can always give us a call and we can help them find a provider. And this is just how it looks on our webpage. If you go to caloptima.org and go to the Medi-Cal provider directory, it gives you an option in finding a doctor, also a specialist that may live near you, finding a behavioral health provider, a vision provider. But again, we do have our customer service department that is available to assist with those questions. And same with other health plans. If someone doesn't choose a doctor, then we will choose one for them. And usually we'll choose a doctor within 10 miles of their home address and someone that speaks the language. But also, even if they choose a doctor and health network, they are able to make changes. So let's say if the doctor they want is in the same health network, then we need to call the health network to make changes. But if the doctor they want is in a different health network, then they would just need to give us a call at customer service to make that change. But again, just reminding members that even if they are assigned to a doctor, they are able to make changes if needed. And these are just some of our health networks that we're contracted with. As I mentioned, Kaiser is no longer under CalOptima Health. So Kaiser, it's now its own Medi-Cal provider. So if there's a member that has Kaiser, they will have to call Kaiser directly for information. But some of these other health networks that we do have under us are like the Optum, Ultimate, Family Choice, United Care. They all provide the same services and benefits. The only difference I say is what providers are under them. But at least, just so members know that they do have options in choosing their health network. And then I would like to talk about the identification card because a lot of times people have the cards, but they don't know what it means. So the top card, it's called the big card, which is the beneficiary identification card. And this card is given by the state of California when someone has Medi-Cal. And the bottom card, I always say it would depend what county you reside in. So anyone that's in California will receive the top card, and the bottom card, if they are a CalOptima Health member, they will receive the CalOptima Health ID card. Something I always like to point out too is the member ID. A lot of times people don't know their member ID, which is their Medi-Cal identification number. So it is helpful to know. But also on the CalOptima Health ID card, it will have the health network they're with and also the provider. Because a lot of times people might be under a provider, under a health network that they're not sure who it is. So it's always good to look at their ID card for that information. If you lose the top card, you'll need to call social services agency to request a new one because it is from the state. And if you lose the bottom card, you can always give us a call at CalOptima Health to request a new copy. But if you do have access to creating a member portal on our webpage, you can also download it from there. And examples of Medi-Cal benefits. So a lot of times we have health insurance, but we don't know its entirety. I mean, I know I have health insurance, but I don't know 100% what is covered under it. And this is the same thing that happens with those that have Medi-Cal. When I'm out in the community, a lot of times they'll tell me, oh, yeah, I have CalOptima Health. So I always respond with, do you know your benefits? And usually they will respond with, no, not really. So it's always good to know what those benefits are, because apart from doctors and specialists, there's medical supplies, there's medications, there's vision, there's dental, lab work, which is important, transportation, and hospice and palliative care. So, I mean, people don't like to talk about hospice and palliative care, but at least knowing that if they are at the end of life stage or point in their life, that it is a medical covered benefit. And some of these benefits I am going to talk a little more in depth, but at least so you have an idea of what those benefits are. And also earlier, I mentioned the CalAIM benefit, which is the state's initiative. And I say this is a state initiative, not a county initiative, because it is through the state of California. But depending on the county will determine the community supports. And these community supports are meant to be benefits on top of the Medi-Cal benefits. Because I would say when we talk about someone's health, it's about having access to healthcare, but also having access to housing, to food. Another big benefit is the personal care and homemaker services. And I always like to emphasize that benefit as well, because if you're familiar with IHSS, which is in home supportive services, that's the only Medi-Cal covered benefit that covers home care at home. Otherwise, it's just private pay. But under this CalAIM benefit, they are able to get personal care if needed. Some of them could have like respite services for caregivers, asthma remediation. And the way these benefits work, we work with providers that already provide these benefits. So if you probably have, and I say the most common vendors probably Project Food Box. They provide the medically tailored meals. There's also another one called Tangelo. They provide frozen meals. So if a member is in need of these services, we coordinate with that provider to coordinate those services for the member. And these community supports are meant for individuals that are like at risk of homelessness, they have chronic conditions, and also those that are coming out of incarceration. And we actually do have a webpage on our page that talks specifically about the CalAIM benefits. And once someone is new with us, and it's usually the same as other health plans, we want them to schedule their first visit because Medi-Cal is a managed health plan, so everything starts with your primary care provider. So if someone is in need of referrals for a specialist, if they need to order medications, complete any routine exams, they will need to visit their provider first. Same thing with specialists. Um, the doctor would need to submit the referral, and then the health network processes the referrals. And usually, most referrals take up to 5 business days to process, but in urgent cases, it can be decided within 72 hours. So, if you do have someone asking, like, how can I get a referral? The answer would be visit the primary doctor first, because everything starts with a primary care provider. And it's the same thing for the medications. Some medications you can't get without a prior authorization. So now you do have to visit the provider if you also want some medications. Another benefit, something that also changed, we used to manage the medicine benefit. So before in the pharmacy, you had to show your CalOptima Health ID card in order to get your prescriptions. But now, because it is through the state, you have to show your big card. So I always tell individuals it's important to carry both cards because the CalOptima Health ID card you'll probably use like at your specialist, primary care provider, and then the big card you will use when picking up your medications and for your dental and vision benefits. So usually covered medications are provided with no copay or out-of-pocket costs. But if members do have any questions related to their Medi-Cal RX benefit, there is a phone number that they can call. And also, a lot of times people focus on the providers, the specialists, but they forget about their vision and dental health. And vision and dental health are also benefits under Medi-Cal, but we call them carved out benefits because we don't administer those benefits ourselves. So for the vision benefits is under Vision Service Plan, known as VSP. And you probably have heard of them because they also manage a lot of the private insurances. But they would have to call the 1-800 number in order to find a vision provider. But under Medi-Cal, they're able to get eye exams and eyeglasses every 24 months, which is every 2 years. Except if someone is diagnosed with diabetes, we know with diabetes, there tends to be more complications. They are able to get eye exams every year. And of course, if they are a Kaiser member, everything has to go through Kaiser. So they will have to go Kaiser themselves to get that benefit. And then for the dental benefit, if you have heard of Smile California, sometimes they refer to it as Dentical California. It's kind of the same thing. There is a number that members will need to call to find a dentist in the area, but also if members ever have questions related to what is covered under Dentical, that would be the number to call. I also like to mention the smilecalifornia.org webpage because it does have a lot of resources. You can also find a provider by county. And it also gives you a little bit more information on what is covered under Dentical. But again, for that specific benefit, they would have to call that number for more information. And then same thing for medical supplies. It is through us, but again, they will have to start with their primary care provider in order to get a referral. So the doctor would just need to write the referral, and then the health network process it. There is a custom wheelchair benefit, but I always tell individuals for medical supplies, there does have to be a medical need. So it's not like I can say, oh, I need a wheelchair, I need a walker. The doctor would be the one to submit the order on their behalf, and then the health network processes those referrals. And then also urgent and emergency care. And I mention these services because a lot of times people are not familiar with urgent care services. I mean, some of us might be, but people that are used to telephoning the doctor, um, are not familiar with urgent care services, and they offer same day walk-in visits with doctors. So let's say if someone woke up not feeling well, they're not going to get an appointment with their doctor. So in this case, they can go to urgent care services. They would just need to call their health network to find locations that accept their health plan. And then for emergency room, um, we want people to use the emergency room for anything that's considered life threatening. So, not going because they have a cold or they have a scratch. We want them to use it for something that are serious illnesses or injuries. So, we always suggest for them to call 911 and go to the nearest hospital. Also, keep in mind that emergency ambulance transportation is a Medi-Cal covered benefit. So it's also important to carry your card. That way, they make sure that they don't get charged for the ambulance ride. And kind of talking about transportation. So mentioned the ambulance ride is covered under emergency transportation, but we do have other two types of transportation available for CalOptima Health members. And these are non-emergency medical transportation and the non-medical transportation, which I will go a little more in depth about. The non-emergency medical transportation, for this one, there has to be a medical need. So these are for individuals that cannot use a car, a bus, a taxi. Think of someone that's in a wheelchair, has mobility issues. So if they are in need of these services, they would need to be requested by the doctor, because then the doctor would need to submit a physician certification statement form, and again, the health network just approves the referral and they are able to get this kind of transportation. And then we have our regular transportation, which can be through a taxi, a bus, a private driver. Keep in mind, transportation is solely for medical related appointments. So that can be if they need to go to a doctor, a specialist, need to go to therapy, whether it's behavioral, physical, occupational, and need to pick up their prescriptions. Also, like if they do get the transportation through a car, they are able to go up to 4 individuals. So let's say like a parent um, has a child that's a CalOptima Health member and they have two more, so that's four in total. There can be up to four in a car for transportation. And that's just our transportation line that's available Monday to Sunday from 8 a.m. to 8 p.m. Again, they would just need to provide their CalOptima Health ID number. And that's why I always emphasize it's important to know it because in some instances they do have to give it out. And then the representative determines what kind of transportation is best for this individual. We do encourage people to request it in advance. So a lot of times I always tell members when they go to an appointment, usually they know when their next appointment is. So I always suggest making the call then because a lot of times when you wait last minute, you forget. We have urgent same day transportation, but that is limited to urgent things like someone that's being discharged from a hospital needs to be go to dialysis, chemo, or any urgent dental appointments. Some financial responsibility. So I mentioned the ambulance ride is a covered benefit, but what is not covered are paramedic services. And these are emergency medical treatments that are given on the scene by a paramedic. So we always suggest calling City Hall for information on coverage of these paramedic services. Also, when people apply for Medi-Cal, if they fall below the threshold line, they tend to not have a share of cost. And sometimes when people do qualify, and they fall a little bit over that income limit, they might have to pay a share of costs each month before Medi-Cal kicks in. And this is told to them in the letter they receive from social services agencies. So it shouldn't be a surprise. But most people don't have a share of cost. But some people, again, if they do fall a little bit above that income limit, might have that share of cost associated. Also, we always get asked questions regarding private insurance and Medi-Cal. Like, if is it possible to get private insurance and Medi-Cal? And the answer is yes. But also keep in mind that the private insurance will be the primary insurance, and Medi-Cal would be the secondary. And usually, I give the example of the Medis, those that have Medicare and Medi-Cal. Medicare will be the primary insurance, and then Medi-Cal is a secondary insurance. But if someone receives a bill for a service they shouldn't be charged for, they can just contact the biller to remind them of their Medi-Cal coverage. And if that still doesn't get solved, they can either contact the health network or give us a call at customer service. Um, and also, apart from all those other benefits, we have our support services. So I always say I'm one department out of many. We are the most external facing department. So we're out in the community, at community events, doing presentations, out at health fairs, sharing this information. So our customer service, they're basically the first ones to answer the phones. They're able to answer questions related to programs, their benefits. Also, if someone wants to file a grievance and appeal, a grievance is basically a complaint, and it can be like transportation didn't come for me. I waited too long in a waiting room at a doctor's office. So also as members, they do have rights as well. And an appeal is basically if a health network denies a referral, they can appeal that decision. Also, help them with any change of health network or providers. And then we also have some very specific programs for certain populations. So there's like the member liaison program, which is for seniors, those with disabilities or chronic conditions, and those that don't have housing have access to care. So our member liaison will work with those members to help them get care coordination. We also have the Whole Child Model Program, which is for the children that fall under the California Children's Services, known as CCS. They get their care coordination through us. And then, of course, we have our case management, which are nurses, social workers that can help members learn more about their health condition, make changes, connect them to community resources, develop a plan to meet their health goals. And then we also have our long-term support services. If you notice as well, in healthcare, we use a lot of acronyms. That's just how healthcare is. But it's good to know what these acronyms are. And I would say that when people have Medi-Cal, it does open it up to other resources. So we have the CBAS, which is Community-Based Adult Services. And those are day centers for individuals that are 18 and older that have a physical or cognitive impairment. So we also do contract with those CBAS centers to provide those services. We also have our multi-purpose senior services program. It's known as MSSP. So these program is for individuals that are 65 and older that do have more, chronic conditions, have a harder time coordinating their care. So we can also have someone help coordinate their appointments, transportation, and then, of course, as I mentioned earlier, hospice and palliative care. Nobody likes talking about hospice and palliative care, but again, knowing that it is a Medi-Cal covered benefit if it is needed. And then we have our cultural and linguistic services. So I'm pretty sure maybe many of us have translated for our parents, and we definitely do not want a child interpreting for their parents with a doctor and vice versa. Because, there might be miscommunication, languages can get lost, and we don't want that to be the case. So, if a member is in need of interpreter and translation services, whether it's over the phone or in person, they can also request it at no cost. And I mentioned our 7 threshold languages. So, also a lot of our materials are available in those languages. If someone needs American Sign Language interpreter, they can also request it at no cost. And then we have our health management department. So they're the ones that do a lot of health education on different topics like asthma, diabetes, nutrition, high blood pressure. Right now, they also do sometimes their own events. So I think right now they've been collaborating with Northgate on doing health education, especially at the ethnic stores. So a lot of times people are like, I don't know what foods to buy to eat healthy, so that's their role, to educate our members on those eating habits. If someone has diabetes, how to maintain their diabetes. If someone has high blood pressure, what can they eat to lower their blood pressure? And of course, they would just need to call our health management department for more information on those classes. And then we also do have incentives for health screenings. And our health education department is the one that manages this benefit. But really, the incentive is so people can get preventative care because a lot of times it's just preventative care. I always tell people, how many of us get our annual checkups every year? I know I like to go every year, and it's just to make sure, how my health is looking like. Do I need to make any changes? So a lot of these screenings are like preventative, like breast cancer, diabetes A1C, a postpartum checkup, especially for a mom that has just given birth. We also have your Shape Your Life, which is a weight management program. So there are some incentives tied to these. So they would just need to download the form with their doctor and then send it back to us to get this incentive. And if they do have more questions related to the incentives, they will need to call the health management department. And CalFresh too, if you're familiar with CalFresh, it's the food stamps program. I think back then they call it SNAP, but now we call it CalFresh. And also, if you notice in California, we like to add Cal to everything. But CalFresh is a federal assistance program that helps individuals and family buy healthy food. Right now, actually, the amounts went up. I think a family of 4 is 973. A single person, I'm not sure what is the new amount. But for someone that is eligible for CalFresh, will receive electronic benefit transfer card. They call it the EBT, and this card can be used to buy healthy food. And I'm talking about like produce. So they can go on Northgate, Vaughn's. I know even Amazon Fresh takes it, and I also seen farmers markets actually start taking the EBT cards. So again, this is just a different separate program for Medi-Cal. We did an outreach strategy because same with Medi-Cal, we don't determine eligibility for CalFresh, but it is another resource that a lot of people were not familiar with or even knowing how to sign up. So we did create a warm line phone number for our members. Like if someone called us, they were interested in CalFresh, we did a warm transfer to social services agency. We also do a lot of text message campaign. If you are one of our members, you know that we love to send text messages. And that's only because we find that's the best way to communicate with our members regarding our benefits, our programs. We also did CalFresh enrollment events. I think this was in 2022. I think we did about 5 events throughout the county. And then we also created posters and flyers that are available in the communities so people are aware of the CalFresh and just how to apply for CalFresh. They can also apply through social services agency, and also a lot of those partners that assist with Medi-Cal, they can also assist in applying for CalFresh. And same thing with Medi-Cal, you're able to apply in person, over the phone, or online. And a lot of times, we focus on our physical health, but also we got to talk about our mental health. So we always like to talk about our behavioral health phone number that it's available. So if let's say a parent, a child is in need of services, whether it's individual counseling, group counseling, they're looking for treatments, medications. I know also sometimes parents with little ones ask about ABA services. This will be the number they can call. And for this service, there is no need for referrals. They can just call directly. But if a member does give us a call, we can help them find a provider and also help them make that first appointment because we definitely want them to use the mental health services. And also, again, it is also apart from our physical health, also talking about mental health. And I mentioned our satellite office in Westminster. It is the County Community Service Center, which actually opened up a couple years ago. But apart from CalOptima Health, a service rep, there is also social services agency. If someone is interested in applying for getting paperwork for a passport, a driver's license, it's also another good center to stop by. And that's just our webpage. We did update it, and actually, they are making changes to make it even more accessible. But it's pretty easy to navigate. A lot of the information members can find on the webpage. The member handbook that pretty much gives them an overview of all their benefits. It's also available on the page in all the languages. But they're also able to create a member portal so they can update their personal information, request a new ID card. Back before COVID, we also used to have new member orientations. And I remember because I used to present at those. But then, during COVID, that stopped. But if a member is new to us, they can request like an overview of the benefits over the phone when they call customer service. And that's just to show how many providers we're contracted with, just so basically people know they do have access to different providers and different health networks. And just some frequently asked questions, anything regarding to us, like if they need a CalOptima Health ID card, change their health networks, they can give us a call or go on the member portal. But anything that has to do with Medi-Cal eligibility, they would have to call the County of Social Services Agency. If they also need to transfer their Medi-Cal to another state or another county, they would also have to go through Social Services Agency. And these are just our main phone numbers. I always tell members these are the numbers they should have in their phone in case they do have any other questions, like our customer service, our behavioral health line. We also have a nurse advice line that's available 24/7, our health management. We have a fraud hotline to report any frauds, and of course, our transportation for the transportation benefits. And other agencies' phone numbers, Orange County Behavioral Health Access Line, Social Services Agency, the Vision Services for the vision benefit, Smile California for the dental benefit, and Medi-Cal RX for the prescription benefits. So I know that was a lot of information, but are there any questions?